Good morning, bonjour tout le monde. Welcome to the fourth symposium on harm reduction. This is the second and hopefully last time that we will meet exclusively virtually. While streaming has certain advantages, it doesn't match the benefits of a face-to-face gathering. Nonetheless, the Planning Committee, the members are found in your agenda, have put together a strong program, and we hope you will enjoy the day. This year's symposium is called Time for a Safer Future. Over the years, the Planning Committee has sought to communicate a sense of urgency. The first symposium in 2018 was called Sounding the Alarm. The second was Keeping Watch. The 2020 event was COVID canceled. But last year, the third symposium was called Time's Up, and now Time for a Safer Future. And the time is long overdue. The mere passage of time has not and cannot lessen the incidence and impact of the overdose epidemic. 24,626 people have died from opioid overdose in Canada between January 2016 and June 2021. 372 deaths have been recorded in New Brunswick over the last 5 years. We hope that this symposium will add to your knowledge and critically examine the many factors that contribute to harms related with substance use. We'll talk about ways to prevent overdose deaths and other related harms, such as homelessness, mental health issues, and contaminated drug supply. This symposium is a unique opportunity to be open and talk with others about safe drug supply and safe housing. Thank you for joining us. There will be 2 short breaks between now and 4:30, the first at 1 o'clock and the second at 2:45. Feel free to use the chat room. Conversations will be monitored and relevant comments will be relayed to speakers and presenters. Let's get started. We'll begin with a land acknowledgement by Todd Ross. Todd is the Indigenous Advisor at UNB in St. John. You'll want to read his bio in the agenda to get a sense of the strengths and contribution he now brings to the region. Todd, over to you.
Thank you, Randy. Good morning. I introduce myself as Wabanakwa and I'm Eagle Clan. I acknowledge that the land on which we virtually gather is the traditional unceded and unsurrendered territory of the Mi'kmaq, the Wolastoqiyik, and the Passamaquoddy people. These territories are covered by the treaties of peace and friendship, which the Wabanaki people first signed with the British Crown in 1725. These treaties did not deal with the surrender of lands and resources, but in fact recognized Wolastoqiyik, Mi'kmaq, and Passamaquoddy title and established the rules for what was to be an ongoing relationship between nations. As we begin the symposium, this statement recognizing the territories and the treaties gives us time to reflect on what's happened in the past and what changes can be made going forward. The acknowledgement marks a small but important step in our journey towards reconciliation and is a way to recognize the enduring presence and resilience of the Mi'kmaq, Wolastoqiyik, and Passamaquoddy peoples, as well as the contemporary communities, which include many First Nation, Inuit, and Métis people from across Turtle Island who now call New Brunswick home. Thank you, Marcy.
Thank you, Todd. We'll next turn to Minister Dorothy Shephard for some opening comments. Ms. Shepard was elected first to the New Brunswick Legislature in 2010. She's held a number of portfolios and responsibilities with the government. She's currently the Minister of Health. Prior to politics, she was an active volunteer in our community, including an early supporter of the Women's Shelter and outreach services for women. Ms. Shepard, it's up to you.
Thank you, Randy. I really appreciate being here this morning. Good morning, bonjour. I think that we can all agree that this pandemic has thrown a terrible wrench into the work being done to prevent overdoses and to protect vulnerable populations in our province. The momentum we were building was interrupted just when the people who needed us most either went into a lockdown or were put into an even more vulnerable situation as COVID spread through shelters and facilities and access to various services was impacted. L'automne 2019, juste avant la pandémie, j'étais encore ministre du Développement social. Notre gouvernement avait commencé à travailler sur le plan d'action sur la dépendance et la santé mentale. We held roundtables with stakeholders. We met with community leaders. We were formulating a 5-year addictions and mental health plan when COVID-19 threw our entire healthcare network into crisis. But despite all these challenges, we didn't let up, and neither did you. In September of 2020, I was appointed Minister of Health, but I continued to work with the team on the Interdepartmental Addiction and Mental Health Plan, which in turn has become one of the 5 pillars for our Better Together provincial health plan. Through the Interdepartmental Addictions and Mental Health Action Plan, we chose a globally recognized framework for approaching drug use, the 4-pillar approach. This approach, composed of the prevention, treatment, harm reduction, and community safety pillars, supports a comprehensive and multi-system approach to addressing this issue. It also recognizes the importance of compassion for those with substance use issues, with the use of supportive approaches, rather than simply tackling the problem by criminalizing those affected with the illness. 2 years later, we know the demand for mental health service has increased 16% in New Brunswick, with youth services needs up 33%. Wait times for high priority referrals are also up, and less than 50% of our citizens in crisis are receiving treatment within national benchmarks. We did have some success for individuals that were in isolation, and we have also made some progress. By embracing the step care model, we are recognizing the importance of compassion for those with substance use issues. By using supportive approaches, we are reaffirming the humanity and the dignity of people who seek treatment, and that we all share in the global objective of rebuilding wholeness, not only in these individuals, but in our communities. As part of the harm reduction pillar, we opened the very first overdose prevention site in Moncton. But there continues to be a need for similar sites and to expand harm reduction services. Overdose prevention sites are key to reducing negative health, social, and economic impacts of substance use on individuals, their families, and communities without requiring abstinence. Meeting individuals where they are at, that encourages connection to other service providers, and minimizing direct and indirect harm from substances. Creating safer environments for individuals that mitigate additional risk. Since November 1st, 2021, we have established 14 sites that offer one-at-a-time therapy, either by walk-in or by appointment. Horizon Health recently reported the wait lists for one-at-a-time therapy have been reduced by 54% over the last 4 months alone. This service not only provides enhanced access to mental health and addiction services, but can also support individuals to navigate to the right level of care and support that they need. As we move forward on this path, we recognize that the work isn't finished. We need to build on our most recent successes to continue to improve our response to those in need and to reduce the stigma. Key community organizations have received funding and supports in order to provide important service along the step care model within communities. We've also approved ongoing funding for the Parent-Child Assistance Program, PCAP, in St. John, a program to support families and women who experience addiction during pregnancy. I want to acknowledge and recognize the incredible harm reduction work being done by so many other frontline organizations, such as Ensemble in Greater Moncton, Avenue B, and AIDS NB, working together as the New Brunswick STBBI Community Alliance. I couldn't begin to thank you all for taking part in this symposium. I've looked at your agenda. It's going to be very, very interesting, and I hope to stay on and hear some of it with you. But please know that I'm so appreciative of the commitment that you have vitally to this important work. And I look forward to our going forward together to help bring these resources to community. Thank you so much.
Thank you, Madam Minister. Let the learning begin. The next session will deal briefly with the Alliance in discussing the power of partnerships. The Alliance is a wonderful example of the evolution and strengthening of the community sector in our province, and how with strong leadership, capacity, and collaboration has blossomed. We're joined this morning by two outstanding advocates whose names are known well by those of us from New Brunswick. Julie Dingwell is the Executive Director of Avenue B, located in St. John, and Debby Warren is Executive Director of Ensemble, located in Moncton. Over to you, folks.
Good morning. So I get to start this off and thank the Minister Shepard for doing such a brilliant opening and really laying the ground for what we want to talk about. Because really this is all about how do we keep people alive? How do we stop putting names on our memory wall? So I'm going to tell you a little bit about Avenue B. We began in 1988 as AIDS St. John. We've been evolving ever since. I began with the organization in we started in 1988. I began in 1999, but I want to tell you that we were one of the early organizations to provide needle distribution, and we began actually in 1992. But, you know, when I started in 1999, we exchanged 799 needles that year. And I remember thinking, that is so many needles. But you know what? This year, we're going to exchange over 460,000 needles. And that's not even taking into consideration that thousands of safer smoking kits that we provide. So we have meth pipes, we have crack pipes. So you know, we've been trying to expand and make it so that people can just access us. However, so, you know, when we talk about the power of partnerships, we have about 7 other agencies that distribute supplies in the city on our behalf. So that's what partnerships can do. We have the Sex Trade Action Committee, with about 20 partners that come together monthly to sit around the table. And you know, that was a committee that started with our St. John Police Force, because police officers kept saying, look, this is a health problem. This is not a policing issue. So now we have this great committee. We come together monthly, we share information, and that way we can help make things safer for people who work in the street sex trade, and we can make residents happier about what's happening. So, you know, I just wanted to take a minute. I was going to go to Paris in July and present at a conference called Justice in Mental Health. And I'm not going to go because of COVID. I'm a bit of a chicken. I've decided, no, I'm not going to go there right now. But you know, the premise of my talk was going to be about what if we did everything different? What if we turned things upside down and started looking at how we might do things differently? And I'm going to give you a quick example because I think that it just sets the stage. So where I work, downstairs, there's a methadone clinic. So one day, as I'm looking out the window, this young man comes up on a bike, parks the bike, goes to go in and get his methadone, but no, he's tackled by 2 policemen, brought right down to the ground. He's handcuffed, put in the car, and he's taken away. So my whole thought around that was, one, because then we found out, of course, he's got later charges because he's been all upset. But you know what? Why wouldn't we let him go in and get his methadone first, then come out? And so then he's not jonesing all day. He's not arguing, pushing back police and getting further charges. So these are little things, you know, little things that we can do to show a little bit of kindness to enable people to move forward, because it just takes that little bit to switch things around, you know, and that one little act would just do so much. So, you know, in talking to you, I don't want to take time away from my colleague in Moncton who has some pretty exciting stuff to share too. But we're busy here in St. John. We've got a new build that's going to happen. Hopefully shovels are in the ground any day now. We're going to have a safer consumption site in that building and provide housing for chronically homeless women. So I think that, you know, we all know what we need to do. We all know that we need safe supply, that we need to make just treatment far more accessible and meeting people where they're at. So if we already know how to do those things, you know what I say? Let's get on with doing them. And let's start today. We know what needs to be done. Let's start right now. And let's do it all with a little bit extra bit of kindness. And I'll turn that over now to my friend Debbie Warren in Moncton.
Hi, Jules, and thanks for that. Yeah, Julie and I could probably take your whole conference time, but we're going to be respectful of all the others who have so much to contribute. And I just want to thank the organizers for having the Alliance to talk about the work we do provincially, to share the work, and hopefully we all learn together. I'm just going to give you, I'm trying to do a 5-minute overview of what we do and just give an idea of what it looks like in an organization such as ours. I mean, we were formerly AIDS Moncton and have worked for years with Julie at Avenue B, formerly AIDS St. John, and also AIDS New Brunswick. And so we've got a great partnership, and we know there's strength in partnership, and we share our expertise and resources. So at Ensemble, I guess informally, because we didn't have any formal program nor supports or funding for it, I started dealing needles out of the corner of my desk, one needle at a time, while we were waiting to get resources in place. And so we've evolved, you know, over time from a whole gamut of services and support for folks who use substances. And, you know, I always just say, I wish you could get to know them like we know them. It's pretty emotional for me because they're everyday New Brunswickers and they don't always get the best of consideration and respect. And so the services we've created have been for them, informed by them. And so we have our harm reduction education, where we have created resources for healthcare and service providers so they understand and know best practices relating to substance use, like what's a cooker, what's a rig. And so we have information for them. We also do training around stigma and discrimination, around use of language, recognizing that addictions disorder is a complex health issue. I'm going to share, like Julie did, a real life situation. Our folks often won't go to the hospital for their serious infections because of how they're mistreated at the hospital. So this one young man, he was tossing up, we have two major hospitals, which one should I go to? So he decided on, and I'm going to name it, let's throw the bouquet where it belongs, at the Dumont. And when he went in, you can imagine it takes some courage to, you know, admit he's a user, admit that he injects. And when he got beyond that with the nurse sat him down and she says, hey, let's look at those veins. And what we're going to do first of all is we're going to find one good vein and you're going to keep it for me. So if I ever have to give you treatment or save your life, we have a vein. You have no idea the impact on that young man's life. He came back to us literally over the moon to think that she did not judge him, she did not shame him, she cared about him, and she demonstrated the care. I wish all of the folks we served got that kind of treatment. So that's my message to all of you in healthcare and service providers, is look beyond the shabby clothes, the teeth missing, the sores. There's a human being, and let's do that. And that's what we try to do in our stigma and discrimination education. We also teach about overdose prevention, naloxone administration, and we also share that with people who use substances so they know about bevel up and not to share. And our needle distribution service, like Julie mentioned, you know, the numbers they had, it used to be a big thing for us to pass out 50,000 needles in a year. This past year, 733,000 needles. The issue has exploded in Greater Moncton. We have over 1,300 unique individuals, mostly in the age range of 30 to 49 years of age, 60% male, 40% female. The staff do training with community service providers around needle safety. We've partnered with the city of Moncton in downtown Moncton, and they've purchased and installed drop boxes around the downtown area so that people can dispose of needles safely. They've helped us create and provide for the general public a needle safety brochure. And we also have partnered with rural pharmacies and outreach services and shelters to give them resources to pass out. And we have the distribution of naloxone kits for folks to take home, whether they use substance or they have a family member. Minister Shepard mentioned the overdose prevention site, and I just want to thank her for her efforts to make sure that happens. This service has saved lives in the short time that it opened since November 25th. We have over 100 unique individuals, and upon intake, they all have indicated, all 100 plus people, that they are either precariously housed or in fact homeless. So they have no other place to use safely than at our location. The frontline staff don't have any degrees behind their names. They're just frontline folks in the trenches, have experience with homeless or people who use substances, and they've been trained in CPR and first aid just so that they are able to respond to an overdose. We have a spectrometer so we can test the substances, and we're working to create a peer-led program. And I can tell you, just in the past month, in a very short time, within less than 2 weeks, we had 5 overdoses. And there was also one in the community that one of our peers was able to administer naloxone. Those 6 lives were saved because we had the service for them. Unfortunately, there were a couple of other incidents in our community where they weren't so fortunate, and the outcome was not at all what we wanted to have happen. Some of you may have heard about our interactive dispensing service, known AKA as a vending machine, but this is not like any vending machine you've seen. Think of a vending machine with an iPad on the front. People are able to access whatever we dispense inside, outside, and that evolved because of COVID funding. We had to shut down for a period, then we had to limit our services, but substance use is 24/7. So this afforded us the opportunity to set the machine up, and people are able to access it when we close our office, so between 4 p.m. and 9 a.m. And we have one in Moncton. We have one that's hosted for us at Sackville United Church, and we soon are going to have one installed in the Rishabakdo Guardian Pharmacy. Again, partners, we could not do this without partners. The city of Moncton has been so supportive in trying to address this issue with us. They funded a full-time position for a wellness navigator. So, and Horizon Health gave us some startup funding as well for this position, but it's really to provide that one-on-one support. So it's not us telling people what they need, it's people coming to us and saying, I could use help with this. So whether it's to access social development, apply for housing, reconnect with family, whatever, we're able to provide them with a cell phone and airtime. Thanks to UNB nursing students and Horizon, we have transportation to get them to appointments, remind them of appointments. So really that wraparound support for them. And those are folks who access any of our services. We also are fortunate, another great partner, Vitalite Health Network. They provide us with a nurse practitioner. Right now, it's 2 afternoons a week, and I'm really working to make that much more than that. But she's able to provide primary health care. Often they don't have access to family physicians, and to address some of those infections so they don't avoid going for health care and that they don't develop into soft tissue infections or endocarditis. And those are by drop-in or appointment, because their life is pretty challenging. They survived yesterday and they have to survive today. They have to find shelter to sleep out of the cold. They have to find food to eat. So that's a lot of work on their part. So they aren't good at keeping appointments, and we need to recognize that and not penalize them. We also, as a result of the funding for the overdose prevention site, again, drop in or by appointment, we have a social worker to provide counseling to them. And I'm mindful of my time, but I really exciting news. We've been working with Dr. Sarah Davidson and her team at Riverstone Recovery Center, and we're very hopeful that by early summer, we will be able to provide the injectable opioid and stimulant agonist therapy to the folks that come to our service. So you can see that we've really tried to develop a center, could always use more floor space, I'll tell you, but a place for people that they can come, that they're treated respectfully. And that's always the resounding, I get so many hugs from people and thank yous from people, just that they have a place to come and that our team is so respectful and treat them like the humans that they are. It's heartwarming. Again, I wish you could get to know them like we know them. They're all super unique individuals. But, you know, we do the day-to-day stuff. We really need to look at systemic changes, as Julie referenced, you know, and we need to work in research that informs some of that. And so along with, you know, Avenue B comes right along with us, and some local committees like them, we have the Greater Moncton Homelessness Steering Committee. We've worked with the Community Task Force, which was led by the Greater Moncton Chamber of Commerce. And we had a local overdose prevention site steering committee of local stakeholders, including people with lived experience, that really helped us to set the foundation for our overdose prevention site. And that will carry on. Along with Avenue B, we also serve on the Atlantic Interdisciplinary, it's a hard word for me, it's like saying spaghetti when you're two, research network. And the current project involves people who use substances, families, and healthcare providers. And it's about identifying what treatments and supports are available, but also what are the challenges and barriers to accessing those supports. And so we've heard some great things around distance and cutting people off from family. And so that will help us to inform and advocate down the road for services. We're also part of the REACH research project, I'm Ready, which is the HIV self-testing kits. And so Avenue B, A's New Brunswick, and Ensemble are the three distributors in the province. But I'm also on a national committee under REACH, and Dr. Sean Rook from St. Michael's Hospital leads this. It's a national committee, and it's about the Health Box project, and you haven't heard about it. And I hope I'm not letting too many cats out of the bag, but it's about establishing interactive dispensing machines, like our nice vending machines, across the country to dispense the testing kits, the harm reductions, and guess what? We're #1 in New Brunswick. Ensemble was like the model unit, and we're building on trying to get up to at least 10 of them around the province, including our First Nations reservations also. So we're really excited about that as it's just starting to roll out. We're also connected to the Dr. Peters Center, which is in Vancouver, and it's a national network of supervised consumption sites and overdose sites, where we get learnings and support each other in the work that we do. That's an invaluable resource for us. And we're also involved in the Canadian Drug Policy Coalition, where we're advocating to decriminalize drugs for personal use, and also to advocate for a safe supply. So that's a really quick rendition of some of the things that we do. But at the end of the day, it really needs to be trauma-informed, focused, and to understand that addictions is very complicated. And it's not just, like I mentioned, the 1,300 people we serve, plus that's not just 1,300 individuals, that's 1,300 families in our community. And, you know, I'll just share one little more real life incident. So in the media, they were talking about these overdoses that we were having from a bad drug supply. And I got a message from someone who was inquiring about a particular individual who I couldn't say yes or no had access to service, but the 13-year-old daughter of that individual was worried about her dad. So without giving any confidentiality away, I was just able to say that all of the incidents that we dealt with at our facility were successful, and the persons were doing well. So it's not just the individual, it's that 13-year-old child. And I want you to always remember that every day you serve someone who's struggling with their issues. Thank you for having us.
Thank you very much, Debbie and Julia. Or Julie, rather. Sorry, I'm not the only one to have made that mistake. Julia was on the CBC this morning and interrupted, and I think she's going to be joining us tomorrow morning on CBC again to talk more about the work that's happening in St. John. We had a last-minute regrets from Amanda Diggins, who was going to join the other two speakers and talk about the work that's being done in AIDS New Brunswick. New Brunswick has a lot of geography, and with apologies to Stephen Leacock, not a lot of people. But I think it's important for us to acknowledge that AIDS New Brunswick has offices in Fredericton, Miramichi, and Bathurst, as well as operating a mobile outreach programs throughout rural New Brunswick.